Okay, so in this section, we're going to start getting into concepts associated with treatment. So we talked about in the first section of the course, the pathophysiology of infertility. We know that different cells, we know that oocytes can be impacted. We know that sperm can be impacted. We know we can have endometrial tissue that's impacted. The cervical mucous membranes, or the cervical factor could be an issue. We know that endometrium is really critical. We know that things like PCOS and endometriosis and fibroids can be factors in infertility. What I want to do is share with you some of the research that's been published and show you an evidence-based model for diet, nutrition, and lifestyle approaches. Now, when we use the word nutrition in this section, referring to dietary nutrition, we're going to actually do a section on nutraceuticals next. So just to give you an idea where we're at right now, for part one of this course, we're now getting into the application part of it. And part two, we'll walk through a step-by-step approach of how to do the evaluation, to look at the big picture and not miss anything, and then how to actually manage patients. But right now, let's just do a good background on how diet and nutrition impact infertility. So my academic goals is to review the literature with you regarding dietary and lifestyle factors that impact male and female infertility. And my clinical goal is to try to incorporate that information into actual clinical applications for each of these male and female fertility factors. Now, this is my main anchor slide for this section, and this really goes over all the key mechanisms that I want to go over associated with infertility. Now, if you look at this, on the left-hand side, we have diet and lifestyle factors that are associated with both male and female fertility in green. And then what I need to do is we'll go through those first. And then what I need to do is then show you the research and go over the clinical applications and information with diet and lifestyle, specifically for PCOS, uterine fibroids, endometriosis, and sperm health. So there's going to be really, when you work up infertility, there's going to be the male patient and the male factor and the female factor. With the female factor, you're going to always try to rule out the most obvious things. PCOS, endometriosis are very common causes of infertility as part of one of the risk factors that's involved. Uterine fibroids has some degree of impact on infertility, and with men, it's sperm. There's going to be a lot of patients that have infertility that don't have a clear pattern. They don't have obvious PCOS. They don't have any kind of anatomical change. They just have infertility. And then for those, you're looking at things like prostaglandin imbalances in the microbiome. You're looking at biotransformation pathways, and you're looking at any kind of dietary lifestyle factors that could be an impactful part of that. So let's just go over some of the research. Now, we talked about obesity already and how BMI and adipocytes impact infertility, and elevate inactive fat cells release adipokines that disrupt feedback loops. And we also talked about how when women are underweight, and even men or women that are underweight, they don't release adipokines that have an impact on normal immune and fertility function too. So body mass index is a part of it. Let's talk about obesity first. So this is what the research shows on obesity. Obesity has a negative impact on pregnancy and is associated with increased risk of miscarriage, gestational diabetes, hypertension, preeclamptic rates, or by default also increase as the need for induction of labor and consequently instrumental delivery, cesarean section, postpartum hemorrhage rates, are all increased in obese women. Weight reduction is without doubt the most significant variable that dramatically alters fertility and pregnancy outcomes. And this is very accurate. When we start getting into risk factors for the newborn, obesity has a huge impact. So obesity in the male or female can have an epigenetic can have an impact on the offspring, where they're more prone to diabetes and obesity as time goes on. So the development of the fetus and the development of sperm may have a tremendous impacts on future risks of diabetes and obesity. And most of the complications that take place with pregnancy in women take place because of obesity. So, and I would also say many complicated cases of infertility, if there's obesity there, just some weight loss, some improvement in insulin resistance, PCOS can go a long way. You don't necessarily have to completely reverse it, but if you can make a dent in it, you can have a tremendous impact on fertility. and risk factors. So this was a paper that was published. It was a systematic review. How effective are weight loss interventions for improving fertility in women and men who are overweight or obese? So non-surgical weight reduction strategies in the infertile have been shown to improve reproductive outcomes in both men and women. Diet, exercise, in combination of the two, weight loss medication, motivational interviewing have all been efficacious in reducing obesity. In women, weight loss from diet and exercise is associated with improving chances of becoming pregnant, and the trends toward improved live birth. Ovulation and menstrual regularity are also aided. So it really impacts every part of the pathophysiology of infertility. And then here's another study that was published that was titled, How Much Does Obesity Affect Male Reproductive Function? Recent studies have explored obesity-related epigenetic effects in sperm cells, which may cause disease in offspring. Moreover, not only in female, but also males, obesity has been linked to reduced outcomes of in vitro fertilization, with a reduction of pregnancy rate and increased pregnancy loss. Several studies have demonstrated that weight loss has been associated with restoration of gonadal hormone levels. So, there's so much emphasis on the female, especially before IVF therapy, and the male obesity factor, how it impacts sperm, and the epigenetic effects it has during the development of sperm in that 2 to 3 window when they're obese is much different than if they were, let's say, lean. Now, when you look at the main mechanisms that impact obesity and reproductive function, this is an illustration that was published in a study, How Much Does Obesity Affect Male Reproductive Function? You can see there's decreased serotonin cell function. Adipokines create inflammatory responses to destroy the cells that make sperm. Chronic inflammation. There's more scrotal temperature because of the body fat that has an impact on sperm. There's increased reactive oxygen species. And body fat is where you store endocrine disruptors. So there's increased storage of endocrine receptors that get released. And then decreased fatty acids and spermatozoa, mostly related to an inflammatory diet. And this diagram here shows the overall effect of diet and nutrition on spermatogenesis, sperm production. So they show a typical example, unhealthy diet, obesity, expansion of adipocytes. These adipocytes increase the oxidative environment because of the inflammatory adipokines they release. This creates reactive oxygen species. This impacts sperm development. We also know that adipocytes increase estrogen production primarily through aromatase. They decrease free testosterone levels. That also impacts aromatization. And these increased estrogen levels have an impact on pituitary outputs, which also impacts sperm. Furthermore, we know that leptin also disrupts these gonadotropin-releasing hormones. So a lot of times, you can get a lot more clinically out of just having a male or female patient lose a little bit of weight than a handful of nutritional supplements and botanicals for fertility. When you're looking at the most effective strategies with someone who's overweight, and even for someone who's underweight, these reducing and improving in BMI has a major impact. This was a study that was published, how much does male obesity affect reproductive function? And they go into this diagram, and they look at the hypothalamus pituitary gonadal axis. And they really go in, again, wants to show how these inflammatory reactions specifically impact testicular factors with the AMPK pathways and create inflammation in the testes. And we also know that obesity is involved with leaky gut and LPS release, and leaky gut and lipopolysaccharides have been shown to disrupt the blood-testes barrier and then promote more oxidative stress and inflammation. And these typically are associated also with erectile dysfunctions and sleep apnea issues, all which impact fertility. Now, in this paper that was published, Impact of Male Obesity on Fertility, a critical review of the current literature, they go on to say that obese men exhibit reduced androgen and sex hormone binding levels accompanied by elevated estrogen. So that's the key common thing that you'll see with a lot of men that have aromatization. Their sex hormone binding levels go up. Their free testosterone, not total, the free testosterone goes down. And if they're aromatizing, they may have elevated estrogens. Reduced inhibin B levels correlate with the degree of obesity and are not accompanied by a compensatory increase in FSH. Inhibin B is involved with sperm production. This complexity altered reproductive hormone profile suggests that endocrine dysregulation in obese men may explain the increased risk of altered semen parameters and infertility. Additional features of male obesity that may contribute to an increased risk for infertility are altered retention and metabolism of environmental toxins, altered lifestyle factors, and increased sexual dysfunction. This was a great review paper that was published in Modern Trends. If you have time, you can read that. It's in your course materials. So more of the same thing with a different illustration here. Basically, fatty tissues have increased estradiol, insulin resistance, sex hormone levels go down, free testosterone levels go down, inhibin B levels get changed, and there's reduced ability to produce sperm. So this being said, like, you're going to get much more out of managing male fertility and sperm function by getting some weight loss than using things like tribulus or zinc or some kind of nutrient. There's really one of the most important pathways is to just try to unwind this pathway to some degree, and strategies you can use to make a difference there could be important. In the Karrasian Institute diabetes course and dysglycemia course, we talked about going through and breaking the vicious cycle of insulin resistance. That could be very appropriate for some patients that are dealing with that vicious cycle of insulin resistance, prediabetes, obesity, chronic inflammation, and so forth. Now, this is a very interesting study. Paternal diet and obesity effects on reproduction. Although most research has focused on maternal obesity, there is growing data to indicate that obesity in the father can affect reproduction. Meta-analyses of human studies found obese males were more likely to demonstrate sperm DNA fragmentation, infertility, decreased live birth per cycle of assisted reproduction technology like IVF, and increased absolute risk of pregnancy non-viability with no consistent effect on conventional semen parameters. This is one of these papers that kind of blows your mind, because what they did is when they looked at the entire literature and did a meta-analysis and they looked at all the different factors that are involved, they found that you may not actually have any abnormal laboratory factors with a semen analysis to indicate there's something wrong. But with men that have obesity, their sperm has DNA fragmentation. And if they take sperm from an obese male and you try to use that for IVF, the outcome of the IVF is dramatically impaired. So unrelated to even semen analysis, outcome changes. If the male partner in the couple is obese or has increased body fat, anything they can do to lower that would make a big impact for it. Now, we know the lifestyle factors leading to obesity: sedentary lifestyle, consumption of fried foods, consumption of sugars, consumption of carbohydrates, decreased consumption of fibers, caloric intake is greater than caloric demand, metabolic imbalances, lack of sleep, and stress without coping skills. If you actually try to make a lifestyle to completely disrupt sperm, that would be it. High amounts of sugars, high amounts of fried food, oxidative stress, glycosylated end products, no exercise, which decreases growth factors and opioids, a diet that's very inflammatory and creates lots of reactive oxygen species, that would pretty much impact sperm in a very negative way. Now, with female obesity, there's its own complications. As we talked about earlier, and we'll look at the impact of female obesity on fertility and pregnancy complications. Female obesity increases insulin levels and androgens, and then you have the PCOS pathway, which impairs ovulation. Androgens impact both FSH and LH, and they impair the domino effect of a menstrual cycle working. So that is one of the most prevalent pathways of infertility. And then female obesity increases systemic inflammation. Some of it is from the insulin through receptor advanced glycation end product activation. Some of it is through the inflammatory adipokines that increase the inflammatory response. And especially if they have prostaglandin imbalances with a diet too high in unhealthy fats and lots of fried foods and lots of butter and very little amounts of healthy fish oils and proper essential fatty acids, they can start to have endometriosis promoted by their obesity. And then the more obesity they have, the more buildup they have of endocrine receptors, because endocrine receptors just store in body fat, which then impacts hormonal signaling. And at the end of the day, when you look at the research and the literature published on female obesity, it really impacts every major complication for pregnancy: miscarriages, gestational diabetes, gestational hypertension, preeclampsia, instrumental device pregnancy, C-section, postpartum hemorrhage. So there's impacts on the mother and there's impact on the newborn because of because of the obesity. Now, when you look at male obesity, again, creates inflammatory adipokines, that creates oxidative stress, that impacts sperm, that breaks down the blood testes barrier, insulin surges, activate the RAGE inflammatory response, that also breaks down the blood testes barrier and impacts spermatocytes. Male obesity promotes suppression of LH and FSH. You can also have changes in testosterone and serotonin-selectin unrelated to aromatase, or you can have aromatase activation and increased estrogen, sex hormone binding globulin, decreased free testosterone, altered hormone signaling, and poor vascular dynamics. So I think for a lot of patients, they don't really understand what a big impact, whether it's the male or female in a couple, that reducing body mass index could take, and all the risk factors and all the physiological factors that cause infertility. If you're working with a lot of infertility patients, a big part of your practice to really make the biggest impact would be looking at some lifestyle and dietary approaches to help them lose weight, as versus a bunch of cocktails of botanicals and nutraceuticals and supplements to try to stimulate their pituitary feedback or have some type of fertilizing effect on them. This is really where a lot of the research is at, and it's pretty extensive and convincing. Now, when you look at exercise, and we specifically, when we look at exercise, we're looking at both male and female factors. But here's some key points that was published in a paper that was called Effects of Exercise on Ovulation, a Systematic Review. There is a clear increased risk of anovulation in extremely heavy exercises, training for more than 60 minutes per day. So there are a lot of patients that have metabolic overtraining syndrome that train too much, that lose their menstrual cycles. I'll show you the mechanisms involved with that in a second. And they go on to say a key point of their review paper, a systematic review. Systematic review means they read all the papers up until date, and they were able to summarize all the key findings. And in your course materials, I always try to put meta-analyses in there. So I'm not cherry picking a study. I'm looking at a composite score of most things that are published, and I'm trying to put systematic reviews in there where you look at the totality of the publications up until that date, and then get an idea of what the trials that are studies that show one effect versus another effect really end up showing when you factor all those in. Now, they also found that 30 to 60 minutes a day of vigorous exercise is associated with reduced risk of anovulatory fertility. So if the exercise is very vigorous, even if it's 30 to 60 minutes, that can impact ovulation. There has been excessive focus on weight loss in non-ovulatory women in the literature, and effective exercise-based interventions in ovulatory women without a normal body mass index has not been explored to date. So there will definitely be in your practice the totally lean, low body mass index female patient that does a lot of exercise, that is addicted to exercise, that will not be able to become pregnant. Those patients are very hard to treat because their lifestyle is one of the key factors that is impacting everything. And if they're just counting on taking some nutraceutical supplements to change that, it's a failed case, right? A failed case that's for sure going to happen. So you really want to make sure you look at some of these patients that come in that are, for example, long endurance runners with very low BMIs. It's pretty clear that their physiology can be impacted. So if their body fat is too low and they overtrain, you get a pretty bad combination when it comes to fertility. So when you're looking at this diagram here, the red represents the negative feedbacks associated with high BMI. I'll show you low BMI as well. But increased body mass index, you get anovulation, you throw off pituitary hormones, you decrease FSH and LH, ovaries and follicles don't work well, there's not enough estradiol to supply the endometrium to be able to prepare for implantation, healthy pregnancy. And what they found is that when people exercise that have increased body mass index, their insulin levels go down, their androgen levels get restored, their feedback loops get improved, the things you see in the blue. And they've done the similar thing with people that have low body mass index. So individuals that have low body mass index, they have low BMI, they work out a lot, their leptin levels are low, lack of leptin can activate opioids like dopamine, Their gonadotropin-releasing hormones are impacted. Their FSH and LH levels are low, so they can't mature their follicles and ovaries. They can't ovulate. They have ovulation issues. And the key thing for them is to reduce their vigorous activity and increase their body fat so they can restore their normal ovulatory pathways and FSH and LH levels. So for them, it's decreasing their overtraining response and getting some body fat back onto their tissues. Now, there's a study that was done in men called The Impact of Intense Exercise on Semen Quality. And they go on to show, this review of the current literature suggests that intense physical activity may affect the semen concentration as well as the number of motile and morphologically normal spermatozoa. Training at higher intensities and with increased loads seems to be associated with more profound changes in semen quality, which are negative, and recreational athletes exercise has either a positive or negative effect on semen parameters. So these papers bring up the good point. The point is that, when you're looking at exercise, there's definitely a group of sedentary lifestyle, male or females, that have this whole PCOS, insulin, obesity issue that they need to unwind. But the most overlooked is the super fit, super athletic, even though they may not be an endurance runner, they may do like high intensity HIIT exercise every day, multiple times a day. They may be on a completely low fat diet. Actually, you want to create an infertility salad. Here's the ingredients you put in: overtrain, have no body fat, and have no dietary fat. Those three things, whether it's a male or female, is going to cause infertility. Now, the male or female that's doing a lot of exercise, cutting out all fats, and has decreased body mass index, appears physically healthy and physically fit, but don't confuse fitness with health. So in order to reproduce, you have to have some body fat. You have to consume dietary fats, and you can't put your body in significant oxidative stress daily for fertility purposes. That may be something that you want to achieve for physical appearance. That could be something that person may wants to achieve for athletic performance, where they really need to improve their endurance and shift all their calories into exercise and away from reproduction pathways. But for reproduction, you have to have body fat, you have to have exercise that is not overtraining, and you have to have fats in the diet, and preferably healthy fats. Now, this was a study that was done on effects of exercise on ovulation systematic review. To summarize, this study is summarized in the systematic review, demonstrate a U-shaped association of exercise with ovulation. With sedentary and overtrained women presenting higher incidence of anovulation, this relationship was accentuated by BMI, with exercise more likely to benefit to overweight women and detrimental to underweight women. And this is the key thing with the concept of, you can't be excessive. So a U-shaped response is exactly what we're talking about when it comes to exercise. There's got to be a point where it's beneficial, but it's not overtraining. So here's the concept of a U-shape. Healthy exercise improves fertility at some point. So like around, you can push it a little bit past, but not go over the hump. So you can have exercise really push someone, create some degree of oxidative stress, create some degree of inflammation, as long as they're not going over the U. And getting to that point where you really increase amounts of oxidative stress inflammation has a rebound effect where your body makes more antioxidants, gases, more growth factors, and those things have a beneficial effect on endocrine pathways. However, if you exercise too much and it gets to the point where you can't recover, and that's the key thing when you're going over this hump, is that the person who exercises does not feel like they can do the same workout the next day. They cannot recover from it. That's where you definitely get into overtraining patterns. Those overtraining patterns have been clearly shown to reduce sperm count in men and impair ovulation in women. So exercise is a U-shaped phenomenon when it comes to infertility. Now, the intensity is important, how intense they do it. It's not just the duration and the frequency. So the combination of intensity, duration, and frequency then lead to these inflammatory responses that then lead to metabolic overtraining syndrome. And when women or men start getting physiological overtraining syndrome, the performance doesn't improve. So they can't run faster. Notice if anything, maybe even their distance of how far they're running with the time they have is worse over time, or they're not getting any muscle mass, they're not getting strength working out in the gym. Those are all signs that they're in a metabolic overtraining syndrome pattern. So for some people, when you look at their exercise as a factor, it's the intensity. For others, it's just the duration, it's too long. And for other people, it's how frequently they're doing. They're not giving a person a body to rest. So whenever you suspect exercise intensity issues, exercise overtraining patterns, you want to find out how intense the exercise is. Maybe that's where you have to work on, or maybe it's how long they're exercising, or maybe they need a couple of days off, or more than a couple of days off, or some day off in order to calm down their metabolic overtraining pattern. And for the most part, metabolic overtraining patterns suppress gonadotropins. You're really putting your body at a physiological stress to perform at the cost of reproduction. So that's really, really important. I can't tell you over the years how many of these patients I've seen. Living in San Diego by the beach, there's a lot of healthy competitors, endurance competitors, Ironman competitors, both male and female, that are really focused on their athletic performance, but they don't understand that their health and endurance performance doesn't equate to healthy physiology for reproduction. So those are the things you have to change. And to be quite honest, there's going to be a percentage of these patients you will never be able to help because they're never going to change their lifestyle. Just like some people never change their lifestyle with obesity. Okay. Now, smoking is an obvious issue. Smoking has major impacts on reproduction. This includes secondhand smoke. So obviously most people that are looking at fertility issues aren't thinking about smoking, but constantly being in an environment with cigarettes, with secondhand smoke is absolutely a risk factor for infertility. So cigarette smoke contains several thousand components with adverse effects on each stage of reproductive function: folliculogenesis, steroidogenesis, embryo transport, endometrial receptivity, endometrial angiogenesis, uterine blood flow, uterine myometrium is a target for cigarette smoke components. It pretty much just disrupts everything. So this was a really good illustration in this published paper, and then just showed what the effects of tobacco are on reproductive function, and it really impacts every part of this. So again, if someone's a smoker, good luck with fertility. But the other hand, if their spouse in the family is a smoker, that could have some significant impacts to the point where, it's one of the main variables where they can't get their physiology under control. In males, most studies have reported reduced semen quality, reproductive hormone system dysfunction, impaired spermatogenesis, sperm maturation, spermatozoa function in smokers compared with non-smokers. And in this study, they actually show a really good illustration, have the components in tobacco smoke, including not just nicotine, but the chemicals that are inside cigarettes, actually disrupt the spermatozoa and impact all aspects of sperm function, motility, concentration, and spermatogenesis. So smoking is devastating to both male and female pathways, physiological pathways. So tobacco smoke in males impacts all aspects of sperm, and in females impacts every single mechanism of the requirements for fertility, from developing a follicle to embryo transport to endometrium to quality of the eggs, and quantity over time can be decreased with chronic smoke exposure. Alcohol is another obvious one. One of the questions people always ask is, how much alcohol can I drink? If I'm trying to get pregnant, is it a really big issue? What are the risks involved with it? So this was a great paper that was published, and it was a systematic review of in 2017. It was a meta-analysis. They looked at 19 studies, and they looked at, in those 19 studies, the total population that was assessed was 98,657 women. And what they found in women was there was really not much difference. That alcohol exposure didn't really increase the risk of fertility. So they go on to say, compared to non-smokers, the combined estimate with relative risk ratio, consumers on fecundability was 0.87. But again, none of these are statistically significant. All of these were found with random chance. There's nothing that was significant. So they're not really finding that alcohol consumption is impacting fertility. Now, it's not the best thing for a fetus. And if you don't know that you're pregnant and you get alcohol exposure, especially if it's a heavy drinker, that could create its own problems for fetal health. But as far as infertility goes, one of the largest done meta-analysis studies of all the published studies has really found nothing that's significant. Now, when you look at males, it's different. Most of the studies evaluating the effects of alcohol in men have shown a negative impact on sperm parameters. This has been reported to be associated with hypotestosteronemia or low normal elevated gonadotropins, suggesting combined sexual and testicular detrimental effect on alcohol. So they're saying alcohol impacts the pituitary pathways and the testicular pathways. And then you'll go on to say in their conclusion, alcohol consumption is associated with a deterioration of sperm parameters, which may be partially reversible upon alcohol consumption discontinuation. So we know that semen quality can be impacted by sperm. This was a meta-analysis, systematic review meta-analysis that was done of multiple trials. And basically what they found was when they were looking at these different parameters, in conclusion, we found that semen quality did not seem to be made worse by occasional alcohol intake, whereas both volume and morphology were negatively affected by daily consumption. So they found that just having a drink here or there didn't really have any major impact on sperm when they looked at all these different studies and trials that were published, that it was really daily consumption. So when you look at the research on alcohol, and just specific to fertility, not the impact on the fetus in a female, alcohol intake has really not been shown to impact fertility. However, it does have a negative impact on the fetus, and alcohol intake, once a person is pregnant, can definitely increase risk for pregnancy complications. So, but as far as fertility goes, it doesn't seem to be a key factor. For men, daily alcohol intake, it has an impact on FSH, LH, testosterone levels, can definitely change sperm motility and lead to infertility. But occasional alcohol intake, meaning not daily, has no impact on sperm. So that's pretty interesting. And that's good to know for a lot of men. Because these are the questions you're going to get if you're working with patients having infertility. How much alcohol can I drink? Can I have coffee? Can I not have coffee? Should I exercise? How much exercise should I do? You're going to see the patients that are addicted to exercise, not being able to get pregnant, having poor sperm parameters, and these are where the lifestyle factors come in. So let's talk about caffeine, how caffeine impacts both male and female fertility. So this was, again, a meta-analysis. Again, I like to choose meta-analysis to take a composite evaluation of all that's published, so it's not cherry-picking a study. So this was a meta-analysis of 35 studies that were published looking at the association between coffee or caffeine consumption and fecundity and fertility, a systematic review and dose responses and meta-analysis. So results from this meta-analysis support the growing evidence of an association between coffee caffeine intake and the risk of spontaneous abortions, miscarriages. However, viewing the reproductive capacity in a broader perspective, there seems to be little, if any, association between coffee and caffeine consumption and fecundity. So basically what they're showing is that caffeine or coffee consumption doesn't impact the ability to develop pregnancy, but it does increase the risk of spontaneous abortion. Now, when you look at when you look at males, they found that this is another systematic review of 28 studies with 9,967 subjects in this composite analysis. They found that semen parameters did not seem affected by caffeine intake, at least caffeine from coffee, tea, and cocoa drinks in most studies. Conversely, other contributors suggested a negative impact from cola-containing beverages and caffeine-containing soft drinks. So they didn't find coffee or tea made an impact, but soft drinks definitely did. As regards to sperm DNA defects, caffeine intake seemed associated with aneuploidy and DNA breaks, but not with other markers of DNA damage. Finally, male coffee drinking was associated with prolonged time to pregnancy in some but not all studies. So the summary is caffeine intake in females has no impact on fertility, but it does increase the risk for spontaneous abortions. So if you have a female patient with multiple miscarriages, you definitely don't want them to have coffee or tea during their pregnancy, especially if they had previous risk factors associated with it. For men, there seems to be no effect on sperm with caffeine intake, but there is definitely some association with soft drink. It's probably the high sugar content, more so than the caffeine. They haven't evaluated those confounders on their study designs, but I would guess it's just the high amounts of sugar that may be impacting it, not so much the caffeine. Now, illicit drug use is obviously an issue with patients, but here's the important thing about this epigenetic effect with paternal drug use is very, very important. So once again, that 2 to 3 month window when male sperm is being made, that sperm has epigenetic effects during its developmental lifespan. And if that epigenetic effect is to turn on genes for certain diseases, if a male is using drugs during the 2 to 3 month time frame where they are producing spermatozoa and using illicit drugs, they can have a major impact on their offspring. So paternal drug exposure has long-lasting consequences in the offspring into adulthood and changes their risk for various diseases. Epigenetic changes in the germline associated with behavioral abnormalities. These include schizophrenia. These include psychological disorders, chronic depressive disorders. Information about epigenetic processes may yield a novel therapeutic approach. So I can't stress again how important that window of time is to really develop healthy sperm. And everything from cocaine use to morphine to nicotine to alcohol has some degree of changing epigenetics of sperm and changing DNA expression that then impact the offspring. So here you can see that alcohol and illicit drugs and pollution basically impact oxidative stress. That oxidative stress impacts DNA by having an epigenetic effect, turning on diseases, and these then impact into adulthood. And then once you have these oxidative stress, and whether it's drug use or pollution and so forth, they change the sperm's DNA where they fragment, and those lead to pregnancy complications, the most common one being miscarriages, preterm births. Okay? So the study shows when you look at illicit drug use in females, with males, it totally changes their sperm, has significant impacts on infertility, but also if the couple was able to get pregnant, there could be some epigenetic risk on the health of the child throughout the rest of their life because of those changes. And then with women, illicit drugs increase oxidative stress. They don't necessarily impact fertility other in an acute immediate pathway. To a high degree, they can change like ovulation and some of those feedbacks, but they deteriorate eggs. So the more eggs that deteriorate, the earlier they get into menopause, the less IVF success they have. So if you have a female patient that was a heavy drug user in their 20s, they're gonna have less ovarian potential as they get older. So maybe they were heavy drug users from age 20 to 25. They stopped. There's a likeliness that they may get into early menopause before age 35, depending on how much oxidative stress that their body went through. So that's something to also take into their histories, if they had any illicit drug use. On some of the forms that I'm going to share with you when you do your evaluation, we ask those questions. And you're looking for to see if there was a heavy period of illicit drug use. In women, it can definitely increase their clock ticking time to when they get enough, when they lose enough ovarian reserve where they are not able to get pregnant or even respond with IVF therapy. And then illicit drug use definitely has an impact on the fetus every negative way: low birth weight, birth defects, premature birth, sudden syndrome, and so forth. And here's again the keynote. Spermatogenesis life cycle is 2 to 3 months. So any illicit drug use in that time frame is an issue. But remember, with female, eggs are developed before birth. All that drugs will do is just speed up the deterioration of them. Doesn't necessarily impact fertility directly. Now, when you're looking at lifestyle and you look at environmental factors that impact them, the other question that comes up all the time in practice is, should I be eating organic food or not? Is it worth it? Is it not worth it? And I will tell you, you absolutely should be eating organic if you're dealing with infertility, because of the pesticide exposure and the amount of evidence that's not published on how pesticides impact both male and female fertility. So this was a paper that was published in the journal Human Reproduction, and they looked at fruit and vegetable intake and their pesticide residues in relation to semen quality among men for fertility clinics. And here what you can see is they broke down the interquartile range of pesticides, and they looked at the total normal count of sperm. And basically what they find is that the highest amount of pesticide exposure they have, the less sperm count they have. And they did the same thing here with motility of sperm. They found if their pesticide levels were in the highest quartile, they had the the least amount of sperm total count. They found the same thing with mobility and the same thing with normal count. And they actually found, especially with sperm mobility and sperm concentration, the more pesticide residue was found in the vegetables compared in an interquartile range, the more significant negative impact was found with sperm. So, and this is just residue from fruits and vegetables you get, and the pesticides you are trying to wash off them. Now, in conclusion, this was another paper that was published. This was published in the Journal of American Medical Association Internal Medicine. This is what they found in their study. And the study, this is a really important study, association between pesticide residues, intake from consumption of fruits and vegetables, and pregnancy outcomes among women undergoing infertility treatment with assisted reproductive technology. Whenever you see pesticide residue, just think of organic versus non-organic. In conclusion, intake of high pesticide residue fruits and vegetables was associated with lower probabilities of clinical pregnancy and live birth among women undergoing infertility treatment. Our findings are consistent with animal studies showing that low-dose pesticide ingestion may exert an adverse impact on sustaining pregnancy, because to our knowledge, this is the first report of this relationship in humans. Confirmation of these findings is warranted. So they actually go in there and they're looking at the probabilities of total or earlier clinical pregnancy loss according to high or low pesticide residues in fruits and vegetables. And what you can see here is the probability of pregnancy is going to be directly impacted by the amount of pesticides that they're exposed to. So the higher the pesticide exposure in fruits and vegetables, the greater pregnancy loss you see here, greater early pregnancy that you see there. So you can see a very clear upward direction here. And then when they look at probability, they look at probabilities with low pesticide foods, the rates of pregnancy go up when there's low pesticide foods. So you see the opposite direction take place. So high pesticides, less pregnancy, low pesticides, greater amounts of pregnancy. So very interesting study. And then they go into here and they looked at the odds ratios when they do IVF therapy by replacing only one serving of high pesticide residued fruits and vegetables with low pesticide residued fruits and vegetables, making one meal, let's say, organic versus non-organic. They see a significant change in odds for implantation working, clinical pregnancy taking place, live birth happening, and a reduction in total pregnancy loss. So just one meal, one serving. Imagine if it's 30 servings. Imagine you had 30 servings with cigarette smoke, with car exhaust, with air pollution, and someone drinking BPA. All those things add up. So when you're looking at infertility, these are important to know. Because this is no longer theoretical. When you have something published in the Journal of American Medical Association Internal Medicine, it's going through the highest amount of scrutiny. And it's a point where lifestyle and environment really does make a difference. And there needs to be some efforts. Now, the problem with functional medicine practitioners that I've seen, there's so much emphasis on lab work and supplementation and so little impact on lifestyle. The discussion of how to become plastic free in your home, the discussion of actually, getting organic foods, decreasing your chemical load becomes really, really important when it comes to infertility. Now, other studies have looked at pesticides. And in this paper that you have in your course materials called Pesticide Exposure, the Hormonal Function of Female Reproductive Systems Disrupted, it just shows all the different mechanisms of actions that pesticides impact on fertility. Basically, everything from fertility to stillbirths to spontaneous abortions to low birth weight were all impacted with pesticide exposures in female humans. And we know that pesticides cause oxidative stress, they have endocrine signaling impacts on the system, and so forth. Now, besides pesticides, BPA, which we've talked about before, is very important. So they looked at BPA and human oocytes maturation in vitro. So this is going to be important for things like IVF therapy. So they did a randomized trial of 352 clinically discarded eggs, oocytes, from 121 patients. And basically what they were able to report is that BPA BPA may be relevant to understanding of decreasing fertility reported for the last decades, that BPA is a significant impact on impacting the quality of the processes involved with in vitro fertilization. And studies done in men have found the same thing. This was a review paper, bisphenol A, an emerging role threat to male fertility. Every major pathway is impacted from semen quality all the way across the line. So when we look at men and women, and we look at the lifestyle factors and dietary lifestyle changes that you want to consider, you definitely want to try to remove pesticides, but have them go organic if they can, or they should, and then reducing their total BPA load. Those two things alone can make a huge impact on some of these major risk factors. So we know it impacts hormone disruption. We know it impacts sperm in males. We know it damages oocytes in females, which decreases IVF success, impacts the risk, increases premature menopause, increases all the risk factors for stillbirth, spontaneous abortions, low birth weight, and disrupts feedback hormonal loops that may cause some subtle infertility issues. When you're looking at patients that have infertility for unexplained reasons, you got to look at microbiome function, you got to look at antioxidant function, you got to look at biotransformation pathways. You have to limit pesticide exposures. By going organic, you have to definitely get rid of plastic substances. Now, psychological stress is another key issue as a lifestyle factor. And one of the things we talked about earlier was not all stress is the same. It's non-adaptive stress. That's just a factor, and the ability to cope is really the key issue with it. So this was a study that was done with 217 couples. They went into assisted reproductive technology treatment, like IVF, and they were given stress questionnaire forms. Here's what they found. Study results indicated that anxiety and depression scores of couples who had achieved a positive pregnancy results were lower than for couples with a negative result. The results of this study will contribute to the health professionals, especially to the nurses who spend the most time with couples in providing consulting services and supporting psychological status of couples during active reproductive technologies. So what they found in this study was if they had really attentive nurses and people to talk to, and they had some counseling of their infertility and how to deal with it, and it's okay, they're able to talk about it, their outcomes was much better. This goes back to the importance of coping skills. The coping skills involves communicating and interacting with other individuals. So there was another study that was done with anxiety, and they found that non-pregnant women reported higher anxiety and depression scores at the pregnancy detection by compared with pregnant group. Lower levels of norepinephrine cortisol at the time of oocyte retrieval and lower levels of cortisol at the time of pregnancy test were found with successful treatment. So when they're doing IVF therapy, for example, when they go and extract the oocytes, if their cortisol and epinephrine was high and were under stress, they had much less successful IVF treatment. And they found that anxiety scores were negatively correlated with live birth rates and positively associated with norepinephrine and cortisol levels. So when they looked at the variations of serum epinephrine, norepinephrine with pregnant females, which are the solid line, and non-pregnant females, they found much, much higher norepinephrine levels with females that went through IVF and were not able to get pregnant. And then they also looked at the same thing with cortisol levels, and they found that non-pregnant women had much higher levels of cortisol when they were extracting the eggs in IVF therapy. So stress responses, especially at the ovarian egg level, is very, very important. Now, there's a paper that was also done with 501 couples followed for 12 months. There was a prospective cohort study that looked at stress biomarkers, and they found that preconception stress increases the risk of infertility. And what they found is they went and implicated in their findings that this was the first U.S. study to demonstrate a prospective association between salivary stress biomarkers and TDPP and association with infertility. So they found that chronic stress preconceptually had a dramatic impact on their outcomes. So once again, psychological stress, if there's healthy coping skills, social groups, exercise, family support, medication, that reduces the impact on fertility. So one of the questions you want to ask in your workup is, what are your stress coping skills? What do you do with stress? When you have stress, do you actually implement them? What do you do for that? If they have inability to cope with stress, non-adaptive stress response, suppression of FSH and LH, impairs ovulation, impairs T4 to T conversion, you have infertility. The worst type of stress in fertility patients is the uninvolved husband, boyfriend, male factor. When they get a male factor involvement that's causing more stress to the infertility and not being supportive, not being a player, it's very impactful on a female's health and psychology. So it's really, really critical that males are active players. If you're working with couples, you have to change your tone. Like, you as a practitioner sitting with a couple should change your tone. One of your main red flags working with couples, if the husband's not there. If you get a female patient in your office working with infertility and the husband can never be bothered to come in and to go through their male factor evaluation, you got a problem. You get a female patient that does not have the coping and support structure that can make a big difference in their outcomes. So, and other times, and most of the times, it's really because they don't think the male needs to be involved. A lot of times, how you create the tone and how you create the environment will determine how your practice will manage infertility patients. It's always best to treat them as couples. It's always important to talk about coping skills and to really make sure that they can catch each other if their stress levels are high and they're not involved with coping abilities. Unhealthy relationships happen all the time because of fertility issues. So sometimes being reminded of these pathways in this research becomes very important. Now, clinical concept. The literature is limited in studies that show various stress coping mechanisms make a significant impact on improving fertility, but we did mention a few of them earlier. So we talked about all these mechanisms that impact both males and females: obesity, exercise, smoking, alcohol, caffeine, illicit drugs, pesticides, psychological stress. Let's talk about males. Let's talk about males and sperm and how does diet, nutrition, lifestyle impact sperm quality. So, and let me tell you why this is important. The reason this is so important is because the male factor is estimated to involve 30% of infertility cases, okay? So 30% of infertility cases are just caused by males' unhealthy sperm. 30% of fertility cases involve both male and female factors. Whenever they say male factors in research, it's always sperm. So you can see that there's a large percentage of infertility cases that have a male factor component to it involving sperm. So at some point in the evaluation and workup, there should be a semen analysis done. These are great because it can be done at home now with in-home testing, where they collect samples and send it out. The other key issue is, even if they don't have any semen abnormalities that are evident with semen analysis testing, implementing a diet and lifestyle to change their sperm can have a dramatic impact on the pregnancy and the health of their child and reducing the risk for miscarriages. So the male factor is a key thing that should be evaluated at some point in the clinical workup. Now, let's talk about this study here. This was a study that was published. It was Temporal Trends in Sperm Count, a Systematic Review and Meta-Regression Analysis. So extensive meta-analysis covering 185 studies, including over 40,000 men from developed countries. The number of spermatozoa, the main factor determining the quality of semen, decreased by 56% over the period of 1973 to 2011. So they found for the past 40 somewhat years, when they look at 40,000 men in all these different countries throughout the world, that they're actually becoming more and more infertile. This trend is continuing to continue. So the numbers are going to continue to go up as time goes on. 10 years from now, 20 years from now, I think the numbers are going to be much, much worse. There are too many environmental factors that are impacting sperm quality. Even worse than that is that these males that had unhealthy sperm are causing epigenetic transgenerational change in their offspring sperm, which makes it even worse and easier for them to have infertility as well. So as each generation continues to have environmental stress, oxidative stress issues, male infertility becomes much more prevalent. So this was a study, and they showed this was 57 cross-sectional studies, almost 30,000 participants over in 26 countries. They found a conclusion: age, smoking, alcohol consumption, and psychological stress were found to be significant risk factors for semen quality in both infertile and healthy men. And then they go on to show a summary of the common exposures that change sperm in humans. In this study published in Andrology, alcohol, tobacco, marijuana, obesity, water pollution, so pesticides, these things have an effect. Now, the most fascinating, interesting thing about, again, sperm is the epigenetic effect in males and the effects of the paternal diet on sperm quality in the offspring. So I think what's really important for males to understand, it's not just about pregnancy, it's about an epigenetic effect. It's about how you have a transgenerational effect from sperm. So during that 2 to 3 month window where sperm is being made, the zygote, the egg and sperm, can be influenced by the environment that they're in. Now, for a fetus, their eggs that they're going to have throughout the rest of their lifespan is going to be impacted by the health of the mother during pregnancy. And during pregnancy, while the fetus's eggs are being developed in the ovaries, the lifestyle they have and the environmental exposures they get, the oxidative stress they have, the amount of inflammation and immune activation they have will have an effect on those eggs and have an epigenetic effect for their fertility and the risk of their offspring for different disorders. For men, it's that 2-3 month window while they're producing their sperm. And those two factors have a tremendous impact on the outcome of their child. So basically in this illustration here, they just show the epigenetic effects, different genes turning on and off with different things. And they found that dietary lifestyle strategies to decrease some of these oxidative stress epigenetic effects, well, guess what? Eat more antioxidants, green tea, grapes, grapeseed, resveratrol, cacao, curcumin can change the expression of oxidative stress that impacts epigenetic changes like histone methylation modification pathways and DNA methylation pathways and so forth, to the point where these epigenetic in places don't take place. That's why it's so important during a female's pregnancy to be very high in antioxidants and healthy diet. And so important for males in that spermatogenesis period to have high amounts of antioxidants and nutrients to optimize their child's health. So during this stage of sperm cell development, where these cell divisions take place, that's where these genes can turn on and off and so forth. So sperm epigenetics and influence of environmental factors. Major conclusion. Like somatic cells, the epigenome of spermatozoa has proven to be dynamic, reactive to a wide variety of environmental and lifestyle stressors. The functional consequence on embryogenesis and phenotype of the next generation remains largely unknown. However, strong evidence of environmentally driven sperm-borne epigenetic factors which are capable of altering the phenotype of the next generation is emerging on a large scale. So while the mom is pregnant, during that egg development in a mom, that's going to have a significant impact on their child's outcome. And while the male is producing sperm, there can be some epigenetic effects that then have transgenerational impacts on their health and their disease process. So here's the other key concept that's really important to understand with infertility. It's not just about getting pregnant. The fact that a female patient can't become pregnant, or the fact that a male patient has abnormal sperm, is a red flag that their physiology and their health is compromised. The last thing you want to do is jump into pregnancy without improving health first. So, a lot of times you got to ask your patients, we'll talk about this more when we talk about management, how much time do you have to try to improve your health? Like, if you look at all the strategies, you can go through the checklist of infertility with them, you can go through all the different strategies. When are you actually planning to really be active and trying to have a kid? Have you looked at reducing all these risk factors first? Sometimes if they can just give you a 4-month window, you can make some huge changes in their health, increase their antioxidant levels, get their blood sugar levels down, get their oxidative stress levels down, and really make a big difference in risk factors when it comes to their health. Sometimes people need longer. Sometimes you don't have the luxury of having the time because they're about to go in for an IVF therapy because they're getting older and they don't have healthy ovarian reserves. So these are all the things that you have to think about. And let's see, moving on here. We know that radiation has an impact on sperm count. So this was a study where they looked at exposure to cell phones, microwave ovens, laptops, and Wi-Fi produces deleterious effects on testes, which may affect sperm count, morphology, motility, and increased DNA damage, causing micronuclei formation and genomic instability, as well as disruption in protein kinases, hormones, antioxidant enzymes. Studies suggest that due to RF EMF exposure, depending on physical parameters such as duration of exposure, distance to the source, and radiation exposure density, have an impact on sperm penetration. So, because the theories of like, hey, cell phone's bad for your brain and sperm, the ones on the brain are having more and more evidence that could be a factor. But for sure, having a cell phone next to your testicles in your front pocket is not a good idea. Having a laptop on your lap on a regular basis when you have infertility and sperm abnormalities is not a good idea. Sometimes you'll actually see semen analysis change because the person is putting their laptop on, like when they're on bed and they work on their laptop all the time, sitting that way. That alone, for some people, especially if they're prone towards oxidative stress, can be a factor why their sperm is not getting healthy. So these things are real, these things are published, and they do have an impact. Now, let's talk about diet. And when we talk about diet with sperm, we really want to talk about fatty acids, antioxidants, and so forth. So this paper was published called Diet and Men's Fertility Does Diet Affect Sperm Quality. It was a review paper. And what they found and concluded in their study was that although the picture of relationship between diet and men's fertility is far from complete, a number of broad patterns have emerged when they review all the evidence. First, increased intake of omega-3 fatty acids, either as a supplement or from foods, nuts and fish, appears to have a positive effect in spermatogenesis. Essential fatty acids are critical for male and female fertility. Supplementation with antioxidants and nutrients involved in the one-carbon metabolism, which they mean methylation, also appears to be beneficial. Evidence suggests that environmental toxins obtained through diet, including xenoestrogens from soy, dairy products, and beef, are harmful to men's reproduction is at best questionable. So I think these researchers did a good job. They went and said, like, we don't really know if soy, like the studies on soy being harmful or even some of the compounds on beef where they have estrogens, they can't find a lot of evidence or a lot of support that has a direct negative benefit yet. So maybe as time goes on, they'll see those changes. But right now, it's very, very clear that nutrients, folate, B12, zinc, and fatty acids have a very clear positive impact on spermatogenesis. And they also know that there's some dietary patterns that are involved with fertility, not so much because of the soy consumption or the phytoestrogen component of the foods, but just by dietary trends and what they see. So what they see is when they do an evaluation, this was a study that was published in Journal of Clinical Medicine in 2020, Diet and Nutritional Factors in Male Infertility. They see a clear pattern with men that have infertility. They have a high intake of red and processed meat, high intake of soft drinks, sweet snacks, low intake of fiber, poor consumption of fish, poor consumption of vegetables and fruit, intake of trans and omega-6 fatty acids, high energy density, meaning they're eating a lot, poor consumption of nuts and seeds. So basically they're getting a diet low in fiber, low in essential fatty acids. And that's the key characteristic dietary pattern of male infertility. And when they look at how you can change that, they're saying eat lots of essential fatty acids, oil, fish, lots of high fiber foods, lots of vegetables, preferably without pesticides, higher intake of nuts and seeds, maybe even supplement with fish oils, using essential oils like olive oil, canola oil. Those things can have an impact on fatty acid pathways. And they also go on to say there's, again, repeated other studies show, the balance between oxidants and antioxidants. You really want to make sure you increase your antioxidants and reduce your oxidants. If you don't, then you have this oxidative stress pattern, which can damage DNA issues. And they go on to show when sperm levels are impacted, with their volume or variability or their quality, these increase the risk of miscarriages in the child and developmental abnormalities. So nutritional status in men is really, really important. And in this review paper you have in your notes, they go through and cite all the different mechanisms of different food sources on male fertility. And then they summarize it in this chart here, and they show different nutrients that have been published in the literature to impact different parts of male fertility. So studies on zinc, manganese, sodium, potassium, calcium. So all the minerals are really, really important. You definitely don't want to have mineral deficiency when you're dealing with male fertility issues. And CoQ10 and fatty acids. And they show that taking these different types of selenium, zinc, copper, fatty acids in sperm and increasing fiber have a direct impact on improving sperm quality and sperm motility. And then this paper here, they summarize the same findings they had, because this is what the literature shows. High amounts of selenium, zinc, omega fatty acids, CoQ10 in supplement form. Dietary pattern, Mediterranean diet would be health conscious, would be good. Lots of nuts, seeds, fish, vegetables can all be important. I mean, some people have concerns with fish with mercury content, so you want to have small type fish that don't hold on to a lot of mercury. And then in this study, they showed a similar chart as the other researchers have shown. Alcohol, caffeine, red meat, processed foods, processed fats, these all promote male fertility. And then diet high in fiber and fatty acids seems to help. And reduce the cigarette smoke and so forth. So they know that in conclusion, higher adherence to a DASH diet, which is like low sodium, high amounts of potassium, high vegetables and fruit, have higher total sperm counts and total mobility scores. This was a study of 209 university students ages 18 to 24. They did a 1-year study. And when they went on a DASH diet, which is a DASH diet stands for DASH stands for dietary approaches to stop hypertension. It's a high potassium, low salt, low processed food diet, lots of vegetables. That there was a dramatic change in a year within total sperm count and mobility. And these are with basically, even with healthy young men, they could see those changes. They could actually look at their sperm mobile content throughout the DASH diet throughout the year. So these are every quarter, and they can see a dramatic change in how their sperm levels changed in this 216 sample study. So adherence to the DASH diet was related to sperm count and concentrations, whereas after its combination with physical activity was positively correlated with sperm motility and morphology. Exercise hasn't helped. Mediterranean diet seemed to help. And then cholesterol, fatty, processed foods basically disrupt the blood the testicular barrier. Unhealthy fats can be harmful. Polyunsaturated fatty acids can be very beneficial to sperm production. And then there's more of these studies listed in your notes with how important essential fatty acids are and how negative trans fats are. So the key thing is when you look at sperm, they have to get rid of trans fatty acids, partially hydrogenated fats. That has a negative impact on sperm. Any kind of fat that's in a box or a bag is a problem. Then they need to load up with fish oils as a dietary supplement, or flaxseed oil or canola oil, olive oil, get a diverse list of different oils in their diet to really have an impact on sperm. And then different antioxidants also seem to be very important. When they look at studies on semen parameters, they can see in a very short period of time different types of vegetables and foods have an impact on fertility production. There's several studies in your notes that show these patterns. And the bottom line when it comes to diet is this. For men, high red meats, high sugar, high processed foods, high amounts of trans fats all promote abnormal sperm. Pesticides, endocrine disruptors all impact healthy sperm and then impact fertility, which then impact risk of miscarriage in a female, and generational effects through epigenetic responses. In that 2 to 3 month window, a diet very high in vegetables that's pesticide-free, diverse vegetables, high amounts of healthy fats, olive oil, essential fatty acid, nuts and seeds, fish oils, evening primrose, black currant seed oil, all those things can have an impact on sperm parameters, high amounts of fiber that are very beneficial. Now, the other thing that I want to talk to you about lifestyle with males is this underwear does underwear really impact male fertility? So this was a study that was published in Human Reproduction in 2018. This was out of Harvard School of Public Health. And they did a cross-sectional study that took 656 males seeking fertility treatment between 2000 and 2017. And what they found was that certain styles of male underwear may impair spermatogenesis. And this may result in compensatory increase in gonadotropin secretion related to higher serum FSH levels among who reported most frequently wearing tighter underwear. So basically what they did, they looked at this study, and so in that study that was published, they did find over a 17-year period, when they looked at success of fertility and fertility centers, the type of underwear that men wore made a difference. So really tight-fitting underwear did have a statistically significant impact on fertility to some degree. They did another study where they looked at 501 couples enrolled in the study for 1 year, and the choice of underwear was evaluated for their ability to have a live birth. And what they did is they took male partners, they measured their semen quality with semen quality endpoints like motility and concentration and so forth. And they took males that wore tight underwear and made it have loose underwear, and people that had loose underwear wore tight underwear. And basically they found out that, in summary, male underwear choices associated with fewer differences in semen parameters, no association with time to pregnancy is observed, reassurance to couples attempting pregnancy. They published this. Here's the problem with this study. They didn't have enough, the sample size was too small to determine the impact of this with the way they did the study. So this is not considered a good study, but it's out there. So this is a study that a lot of people reference when they say underwear doesn't matter. This one was a much better designed study. So at some point there seems to be some effect with underwear. I don't know what significant role it plays, but if people ask you, you could say the one large trial that was published showed that did have some type of an effect. When you look at the other impact, which is radio frequency electromagnetic field, we talk about cell phones, wireless laptops, wireless internet servers, TV broadcasts, microwave ovens, radar, cell phones. The greater exposure to them has been shown clearly in research studies to impact male fertility. So what does all this mean into a clinical setting? I summarized it for you in this one slide. Lifestyle and behavior, okay? So obesity lifestyle, sedentary lifestyle, lack of exercise, smoking, secondary hand smoke, daily alcohol consumption, daily soft drink consumption, illicit drugs, pesticides in food, psychological stress, and lack of coping skills all negatively impacts sperm health. Diets that are very high in red meat, processed meats, fast foods, soda, cholesterol-rich foods, trans fats, fried foods, all have a negative impact on sperm health. Things that impact sperm health is high antioxidant foods, fruits and vegetables, increased fiber, essential fatty acids. Underwear that's too tight, hot spas impact sperm, radio frequencies, cell phones in the pocket, laptops on their lap. These all have an impact on sperm function. So when you see men that are trying to improve their health, you may want to, give them just a quick summary sheet of what those things are. Now, moving from males, let's talk about females. And with females, we have things related to, the way I broke this up with females as we talk about diet and lifestyle is specifically for PCOS, uterine fibroids, and endometriosis. So remember with PCOS, insulin resistance causes compensatory hyperinsulinemia, elevated insulin levels stimulate androgen production. Androgen productions inhibit follicle development, prevents ovulation. You have this polycystic ovarian syndrome pattern. And this study that was published in Nutrients, they show that lifestyle modifications are recommended as a first-line therapy in PCOS. In conclusion, women with and without PCOS have comparable dietary and physical activities. This is very interesting. In the study, they wanted to see if PCOS women actually had less exercise, like whether they're sedentary, and they found, when they compare them to controls, PCOS women don't necessarily have less exercise. Because one of the key things is that people assume that if you have PCOS, you may not getting physical activity exercise. As a matter of fact, you're going to see many patients with PCOS eat really well and exercise and still have insulin, androgen disorders, and obesity. And part of that is because of the vicious cycles we talked about in the diabetes course. But we know that one of the key things with them is to improve their lifestyle so they can have some degree of weight loss. And in this paper that was published, a systematic review, they found that, even if the exercise levels are less or about equivalent to people that don't have PCOS, if they do exercise, they do have significant improvements in their ovulation and reduced insulin resistance, especially if they have weight loss. So that does seem to make a significant impact. And magnesium and other nutrients were associated with it. There's lots of studies that put in your notes that go into healthy diet, how carbohydrates promote inflammation, high carb diet with PCOS promotes the infertility. And really, it's at the point of dietary and lifestyle approaches. For women that have PCOS, they pretty much have to go off sugar. They totally have to decrease their carbohydrate intake. And some of the strategies we talked about in the diabetes course of getting into ketogenic diets, intermittent fasting, may be crucial for them to break this down. We also know that dietary advanced glycation end products, so when you look at food and it's like browned, they fry it or they add sugar to it and it kind of browns the food, or the higher temperature foods that are fried on a very hot surface with oil, those increase advanced glycation end products in foods, and those also increase polycystic ovarian syndrome patterns. So there should be some reduction in foods that are cooked in very high temperatures with oils that have that browning effect that tends to really promote their system pathways as well. So this is a diagram that shows the lifestyle and dietary factors that impact PCOS. So sedentary lifestyle, lack of exercise, endocrine disruptors, obesogens like pesticides, psychological stress without coping skills, they all make PCOS worse. High carb, high sugar diet with high amounts of advanced glycation end products, meaning foods that are browned through heating. Reduced insulin, and then high fiber diets and magnesium-rich foods that reduce insulin surge seem to have an impact on diet. And ultimately, the key thing is to break out of this vicious cycle. Women that have PCOS have this insulin resistance. So they have this chronic inflammatory pain response. The muscle mitochondria shuts down, so they don't want to work out. Then they have decreased exercise motivation. Their androgen levels go up. That promotes insulin resistance. They have more sugar cravings. They have an inability to lose weight. In the diabetes course, we talked about metabolic syndrome in diabetic patients where we have to get them into a ketogenic state, then put them into intermittent fasting state, and then provide them with nutrients for AMPK and sirtuin pathways to really make a big difference for that. I don't have time in this course to go through the details of that, but these PCOS patterns really require aggressive vicious cycle unwinding. And one of the key things is completely limit sugars and carbohydrates, increase physical activity, probably getting them into a ketogenic state and use some intermittent fasting to drop their weight and break them out of that insulin androgen pattern. Now, there's a section on your notes when it comes to dietary, nutrition, lifestyle for and ovulation for female that don't have regular cycles. So we talked about two types of BMI pathways. They both impact menstrual cycles. Increased BMI, you have this PCOS insulin resistance pattern, high adipokines, high inflammatory prostaglandins, and then low BMI, low calorie, malnutrition. These impact adipokines, which impact the pituitary feedback loop, and then excessive physical stress. So you got to catch these women that have an ovulation from lifestyle, from having this PCOS, lack of sedentary or lack of exercise, sedentary lifestyle. Those that have excessive overtraining patterns, and those that have very low body fat. And those lifestyle changes can be very hard to do. Now, let's talk about fibroids. Uterine fibroids can be a risk factor for fertility, especially if it's submucosal fibroids. And this is a illustration that shows like lifestyle, endocrine disruptors, everything we've been talking about. Diet has an impact on fibroid development. And this review paper shows the same thing that they show with males. They have to have high amounts of healthy food, healthy essential fatty acids, high amounts of vegetables, high amounts of fiber, and reduced intake of processed meats to really improve their fibroid activity. Now, the dietary, lifestyle, and nutritional changes you see with fibroids, you should know one thing. You're not going to expect to see fibroid size change significantly with dietary and nutritional interventions. Diet and lifestyle changes with fibroids just reduce them from new fibroids developing and from the existing fibroids from growing. So know that, because it's going to be very frustrating for you if you have a female patient that has uterine fibroids, submucosal type. You put them on an aggressive diet nutritional protocol, and their fibroid is exactly the same 4 months later. Now, clinically, you may have actually done a really good job because they haven't developed new fibroids and that fibroid hasn't grown. But it's hard to say if that was actually what happened or if it was just you did nothing. But you wouldn't expect a dietary protocol or even any kind of nutritional supplements to actually change the size of the fibroids. Now, we know when we talk about fibroids, estrogen and progesterone stimulate growth, insulin stimulates growth. And the key thing with fibroids is fibroids have increased sensitivity to progesterone receptors, PRB receptors, and they have increased inflammatory cytokines. And then endocrine receptors also promote fibroid growth, but diet and lifestyle do not appear to shrink fibroids, they only prevent future growth. Sometimes some women that have multiple fibroids, they have to go and do some of the embolization therapies that gets rid of the fibroids. So what they do is they basically take a line into their femoral artery or to their renal artery. They get the camera all the way into their fibroids under fluoroscopy, and then they release chemicals that embolize the blood flow to the fibroids, and then the fibroids shrink. And they can maintain their uterus, and that could be one way where some issues with fibroids can be dealt with. Now, most fibroids are not going to be a factor with infertility, but some fibroids, especially the submucosal type, may release inflammatory cytokines that impact implantation. And if the fibroid is too large, that can get in the way of healthy fetal development as well. So fibroids is really where you start to trend into the anatomy changes impacting fertility, and you got to see what you can do with diet, nutrition, lifestyle. Now, a summary diagram that shows what happens with fibroids, first of all, is talking about genetics. For most women that have fibroids, it's not really just due to diet, nutrition, and lifestyle. There's some strong genetic impacts from fibroid developments, and listed some of the genes for you over here. And for some women, these genes turn on, and these genetic influences have a greater impact on fibroids than anything from risk from lifestyle and risk factors. Like PCOS is typically caused by women that have blood sugar issues and obesity. It's very much linked to diet and lifestyle. Fibroids are not as much. Fibroids are definitely impacted by genetics more than anything else. Now, we know that age is one of the key factors of fibroids. They keep going up in size until age 50, where they start to shrink after menopause. Race has an impact on fibroid development. African descent has a much higher rate of fibroid development than whites, Asian, and Hispanics. BMI, insulin resistance, diabetes, PCOS, vitamin D deficiency all impact risk for fibroids. Reducing those mechanisms don't shrink fibroids, just stop the growth of existing fibroids and new ones. And then lifestyle factors that have been shown to have some impact on fibroids are all the basic stuff we talked about: smoking, alcohol, caffeine. And then as far as diet goes in research, red meat, processed foods increase fibroid growth, and then essential fatty acids, fruits and vegetables, decrease fibroid growth. And I think what you're seeing as a trend is how important essential fatty acids are, how important fiber is when it comes to fertility, how important diverse vegetable fruit sources. These things impact the microbiome. These things provide a rich source of antioxidants, and they have a huge impact. Now, endometriosis is another main group of research that we've talked a little bit about. Again, same thing that you see with endometriosis. The biggest thing with endometriosis is fatty acids, prostaglandins, fish oils, omega-3 fatty acids, and trans fats. So dietary factors may decrease risk of endometriosis. It includes consumption of vegetables, antioxidants, B vitamins, dairy products, D, fish oils, omega-3 fatty acids. Dietary factors that may potentially increase the developing endometriosis: consumption of trans and saturated fatty acids, red meat, ham, as well as alcohol. So when you look at the pathophysiology of endometriosis, it's turned on by prostaglandin 2 pathways, PG2 pathways. And PG2 pathways are promoted by red meat, shellfish, butter, and these very fatty substances. And the combination of these inflammatory dietary changes with a lack of anti-inflammatory prostaglandins really creates the stage for developing things like endometriosis. So these studies really go into these lifestyle changes and the factors that are involved with them, like again, really saturated fat diets make an impact. And they know that when there is some dietary modification to their fats, that there's a reduced aspect of inflammation with people that have endometriosis. And they also know that antioxidants seem to have a major impact on the progression of endometriosis and the inflammation of endometriosis and so forth. So what you'll see in these studies is this common trend we're seeing with all these different plant compounds and how important they are for managing endometriosis. I'm just going to summarize through these and then get to a few important diagrams here. Okay. So one of the things to really understand about endometriosis and the pathways that are involved is that there's this promotion of pro-inflammatory prostaglandins. So when they have a shift and they have a diet that's really, really high in trans fatty acids, partially hydrogenated fats, and not enough healthy omega-3, omega-9, or omega-6 oils that are anti-inflammatory, you get this shift into really changing the peritoneal tissue. And then once these endometrial tissues are developed, prostaglandin fluctuations that take place from diet can have a tremendous impact on pelvic pain, inflammation, and the endometriosis can end up leading to scarring and inflammation throughout the pelvic cavity. And these endometrial tissue release inflammatory mediators that then have an impact on tissue function. So here you can see in this diagram here, prostaglandin E2 receptors. Prostaglandin E2 receptors turn on the inflammatory cascade, and it disrupts endometrial cell activation, promotes pro-inflammatory responses, and then those things impact endometrial type functions. So when you're looking at pathways that are involved with lifestyle and diet, the key things that have been shown to impact endometriosis is alcohol, coffee, pesticides, endocrine disruptors, things that impact endometrial growth, red meat, ham, trans fats, these all increase prostaglandin 2. Studies have shown GMO, GMF foods increase prostaglandin inflammation with endometriosis. And then things you want to do when you have to work with the patient as endometriosis is implement strategies to increase their fatty acid intakes, the healthy ones. We'll talk about this more with this nutraceuticals. High amounts of vegetables, fruits, green tea, anti-inflammatory compounds, gluten-free diet, FODMAP diet has also been shown to be helpful. The other key thing is that research has shown that inflammatory conditions like celiac disease, inflammatory bowel disease, autoimmune diseases, they increase inflammation in the peritoneal tissue, and then those things end up causing this inflammatory cascade. So, in summary, when you're looking at diet and lifestyle factors that impact fertility, all the ones on this diagram on the left-hand side have an impact in both male and females. And then with males, we went through how important oxidative stress is, inflammation is, fatty acids are for sperm health, and micronutrients and antioxidants are. And for females, with PCOS, it's all about getting that insulin levels down. With uterine fibroids, it's mostly genetic. It may not have much impact with diet and lifestyle alone. With endometriosis, all about prostaglandins, fatty acids, inflammation, and reducing the total inflammatory load in the body. So those are the key dietary strategies. I'm going to show you how to implement these with nutraceuticals next. And as we get into the course, we'll go through the evaluation and talk about how to approach this with patterns of infertility. Because some women will have PCOS and endometriosis and lower high BMI and uncoping skills with stress. So you're never going to look at one factor alone when you look at infertility. There's always going to be a combination of factors that are involved causing their fertility when you look at their web, and then you have to kind of figure out how to mix and match their diet and lifestyle strategies. For the most part, you'll see some very common trends in males and females with how diet and lifestyle impacts fertility. And it's really a diet that's low in processed foods, high in vegetables and fibers, very high in anti-inflammatory prostaglandin foods, essential fatty acids, exercise on a U-shaped type phenomena, and decreased oxidative stress responses, right? The key thing is those things are not theoretical anymore. Those things are absolute fact. So when you're working with patients with infertility and you're implementing diet, nutrition, lifestyle, those are really the things you want to help them arrange in their treatment protocol. Okay, thank you for your attention.